Welcome to our clinical feed presentation. I'm Amy Trahan, and Connie Stokes and I will be presenting on epilepsy. Epilepsy is a condition where normal brain activity is disturbed. The cortical neurons in the brain are excessively firing, and this disturbance causes seizures. A seizure is a sudden, uncontrolled electrical disturbance in the brain. So the seizure is the event, epilepsy is the condition. Epilepsy is diagnosed when at least 2 unprovoked seizures happen at least 24 hours apart. Epilepsy may be due to a genetic disorder or an acquired injury such as a traumatic brain injury, stroke, or tumor in the brain. Epilepsy occurs in about 4 to 10 per 1,000 children. Currently, there are approximately 470,000 children in the United States who have epilepsy. Seizures are classified as either focal or generalized. Generalized seizures involve both sides of the brain, while focal seizures are localized to a specific area on one side of the brain.
Because there are different types of seizures that epilepsy encompasses, each one will present differently. We've created a comprehensive list that covers the clinical presentation across these subtypes. This will help you identify some common signs and symptoms that may not always be easy to recognize in the pediatric population. So we have E, eyes blinking or staring. Then we have P, postictal fatigue. Then we have I, instantaneous falling. L is next. Loss of consciousness, back to E. Eerie sensations or feelings, again with P. Pause of speech and breathing. Then we have S. Sweating and stiffening, last is Y. Yanking persistently. Put it all together, and that spells epilepsy. There are 5 main occupations that are impacted by epilepsy. The first is activities of daily living, particularly with bathing. The second is education. The third is play. Children with epilepsy should avoid dangerous play such as unsupervised swimming, rock climbing, or tree climbing. The fourth is social participation. Some children may have psychosocial issues or experience side effects of medication that can interfere with social activities with friends. And lastly, the fifth is sleep. The following audio reflects these affected occupations from the point of view of a child with epilepsy.
During ADLs, we have to be safe. Trade a bath for a shower when we want to bathe. Focusing is an obstacle when they educate. Staying organized is hard when you can't concentrate. Having a buddy and avoiding dangerous play. Sometimes get anxiety while we participate. Might get irritated when we medicate. Seizures can affect my sleep and cause me to awake.
Anti-seizure medications, or ASMs, are the first line of treatment for children with epilepsy. The goal of this intervention is to prevent seizures with little to no side effects and to improve quality of life. Selection of this medication is based on seizure type. Typically, narrow-spectrum drugs are used for focal epilepsy, and broad-spectrum are used for generalized epilepsy. Alternative medicines can also be used to reduce seizures, including cannabidiol and vitamins and supplements. If 2 or more ASMs have failed to treat a child with focal epilepsy, resection surgery has shown to have effective outcomes. If there are multiple affected areas, or if the seizure focus cannot be identified or safely removed, palliative surgery is an option to reduce these seizures.
There are several areas that can be a focus of therapy for clinicians and their patients with epilepsy. Here's a great acronym for remembering therapeutic focus. CHECKS: coping, home, education, keto, and stimulation. Coping and self-management skills are very important for younger patients to understand their diagnosis, where to go for support, and how to talk about epilepsy with their friends and classmates. Home and school modifications are critical for creating a safe and accessible environment for the patient. Education for the patient and their family includes safety precautions and avoiding exacerbating factors. The ketogenic diet possibly can help control seizures in some people with epilepsy, and the stimulation of the vagus nerve is a neuromodulation that provides electrical stimulation to try to control seizures. Thank you.